Hey, hello, I'm Jesse Selber. I'm the surgery service line chief at Corewell Health East, and I'm also professor of plastic surgery there. I've been a microsurgeon for the last 16 years, and I've been performing robotic surgery for also the last 16 years, and I have a comprehensive reconstructive practice from head to toe.
My name is Andrea Moreira. I am a plastic surgery surgeon at the University of Pittsburgh. I'm the director of innovations on the breast reconstructive side. I'm also an associate professor at the University of Pittsburgh Medical School. I've been doing microsurgery for about 11 years and robotic surgery since 2021. Microsurgery in itself, it's very complex and it does require a very high level of precision. Traditional methods with microsurgery, often we have some limitations on dexterity, on stability.
Manually anastomosing a vessel that's less than a millimeter in diameter is enormously technically challenging. This situation mostly arises in the context of lymphedema surgery, where lymphatics and venules are routinely less than half a millimeter. And at this size, a surgeon will run up against basic human physiological limits.
On top of all that, this high precision can be very demanding on the surgeon, and that can lead to fatigue. And really, you have to worry about potential to compromise outcomes because of that.
A secondary problem is operating in restricted areas or small places. Prophylactic lymphovenous bypass following lymphadenectomy is the fastest growing lymphedema surgery. The axilla presents significant access problems. There's really only room for one surgeon. It's a very unergonomic position. I view robotics as having two separate beneficial components. One is minimal access, and one is precision. We're at a point in microvascular surgery where vessel caliber greater than about 2 millimeters, our success rate is very high, but it drops precipitously with vessel diameter. As we get into smaller and smaller scales, the role of a dedicated microsurgical platform becomes more and more relevant. And in a low flow system like the lymphatic system, particularly with the additional problems of venous hypertension and dysfunctional lymphatics, which are components of most lymphedema, precision is really differentiating between an operation working or not working.
I feel that having a platform like the Symani all the time will directly translate to better outcome for my patients. It's going to reduce the need for further procedures. It's going to improve satisfaction. And using the robot, as you get experienced with it, you actually shorten your surgical time. You avoid all those steps that you're doing in a traditional microsurgery because you have to be on a certain position, you have to access a certain space. In my mind, it gets me excited when I can go to the OR, offer a procedure that I can actually do with precision in a very comfortable position.
I'm involved with a lot of different components of the breast journey, the breast cancer journey, and the robotic parts. We're now doing robotic nipple sparing mastectomies. Okay, so the advantage of that is it minimizes an incision and allows you to, have a much lower morbidity mastectomy. We can then do a robotic deep, which is a much less invasive form of the deep operation. Before I started doing robotic deeps, the conversation was, and this is the conversation I think that most people will have with patients, we dissect as much as we need to in order to get the vessels out. And we can try to keep that to a minimum, but anatomy depending, we really can't guarantee a minimally invasive approach to this operation. What I can do now is I can really be within, a couple of millimeters precise about exactly what the patient is going to experience in the operating room and the effect that that's going to have on them for the rest of their lives. And that's a very powerful tool. If you then add in something like the Symani, if you've done a robotic deep or you've done, and in combination with a robotic nipple sparing mastectomy, let's say, you've got a very small access incision now to do an anastomosis through. So having the Symani in that portion of the operation allows you to kind of maintain a robotic approach through the entire continuum of breast care. and then add to that lymphatic reconstruction at the same time. And now you've created a continuum where you've used the robot for the mastectomy, you've used the robot for the deep, and then you've used the robot for the anastomosis and from lymphatic reconstruction. So from front to back, you really have the lowest footprint, lowest morbidity, most precise version of this set of procedures.
I love when you talk about the robotic mastectomy because if you think about a minimally invasive surgery, wrapping a robotic mastectomy and a deep flap or whatever customized flap you're planning for that patient, doing a microvascular anastomosis with a platform like the Symani, and doing prophylactic lympha for a patient who is having a lymph node dissection at the same time, I think it's the ultimate procedure for a patient undergoing breast cancer and reconstruction.
The lifetime cost of managing lymphedema conservatively without a cure is enormous. And now that the era of lymphedema surgery is in full swing, we have the opportunity to transition patients from management to cure. Even though the robot's expensive, the financial impact of curing a chronic disease is massive, and the potential for getting into value-based contracting and other mechanisms that make capital expense more affordable becomes very attractive for health systems if you are thinking about that as a population health approach.
The precision offered by the Symani will allow for better surgical outcomes. That is also good for any hospital system because it decreases the number of follow-up procedures and improves overall satisfaction. It's not the cost of the robot, is everything that you can do if you have the robot. Centers equipped with the Symani, they will have the potential of draw patients from far, from all over the country or all over the world, positioning themselves as like a leader on innovative surgical technique, which I think it's really important.
So how do you build a team and get it to be a high functioning team? So I've done this now at a couple of different institutions with a variety of different robotic procedures over the last however many years. First, you have to give people the why. So what is this actually doing for patients? Because a lot of the time, if a team walks into a room and there's just a piece of machinery, it's just a new thing that they have to learn. And it's just another thing on their to-do list. But if they understand how this is helping patients and that they're involved in, improving patient care and developing innovation, then it gets them more on board. You've got to do a dry run with no patients in the room and go through the procedure. And then you have to sort of be patient as you teach the team how to get more and more efficient. But the team in the operating room is very much like the pit crew for a race car. You can drive as fast as you want. You can be as skillful and precise as you want. But when you pull off into the pit, if they can't get you out of there in a hurry, then you lose the race.
I find out that I keep people engaged much more if I turn that patient into a person actually in the surgical table. So it's not one more patient. It's somebody's mother, it's somebody's daughter, is someone who had a hard time during her life or whatever, but you need to make that patient a person. Um, and that changes everything.
The other thing is training. We have students, we have residents, and we have fellows. So they need to be taught. I've published this, and others have too. The learning curve in robotic microsurgery is shorter and steeper than in conventional microsurgery because the hardest thing to learn in conventional microsurgery is how to slow down and control your physical movements.
In terms of training residents and fellows, we've looked at our, robotic deep learning curve, and really takes about 10 cases for a fellow or a resident, for anybody to actually become proficient when we compare to a general surgeon who is already doing robotic surgery for a long time.
When you start to talk about democratizing a technique, people get very nervous that the expertise will evaporate somehow. The skills in robotic microsurgery are exactly like the manual skills, and I think they're directly transferable. So I think the concern over skill degradation, which is real in a lot of technology adoption, I don't think it applies in this particular case.
everybody is worried about losing their skills. I think you don't lose your skills, you just add to them. You're not losing a skill that you necessarily need to have, you are perfectioning other skills that are much better for your patient's outcome.
The creation of the robotic task force has given a voice to the various people who are out there who have adopted this procedure over time and this set of procedures over time, and can come together and speak with one voice to the community of plastic surgeons as well as to patient groups about why we do this, why it's important to us, why it's important to patients. And it also just gives us a place to get together and talk about best practices for robotic surgery.
But I'm very happy we got together to create a task force. Now it's a subcommittee of ASBS because I do believe that we gave voice to a lot of plastic surgeons that were really interested in robotics and they did not know where to go. And it amazes me how many people are interested. I keep saying that we hit the tipping point. I think for now on, there will be more and more interest in robotic surgery because now they know that can be done with the use of a platform like the Symani. Surgeons will be able to do procedures with greater accuracy, efficiency, which will lead better outcomes for our patients. I think with this money, we're going to be able to explore new frontiers on microsurgery that we don't even know yet.
So the future of all surgery is robotics, and the future of robotics is autonomous AI-driven robots. Machine learning is based on high density source information that's grounded in outcomes. In this case, recorded videos of surgery through a robotic vision system provides high density source data, and a successful anastomosis is an outcome that's grounded in the truth. The more videos that you can use to train a machine learning model, the better it becomes until it can actually do the task. So there are characteristics of an anastomosis that make it really an ideal substrate for this kind of approach. It's a very discrete set of activities that can be broken down into subroutines. So a model can be trained on these subroutines. A supervising surgeon can gate them based on successful task completion. And then if you string tasks together, you have a complete operation that can be autonomously performed under surgeon guidance.
AI and robotic surgery, they really go hand in hand. That superhuman capacity of collecting data will help us to map the procedure that we are doing. They might be able to tell you which way you should go because it's better, where to put your stitch because you're going to have a better anastomosis that way.
I think that it's now safe to say that surgery is, generally speaking, transferring to a robotic platform in just a vast number of areas. And we're going to see that trend continue over the course of our lives and the lives of the people we train. And so, knowing that that's the destination, that we're going to arrive there, I think the sooner that we begin the journey, the better off that we'll all be.
A platform like this money has the potential to transform the way we do a lot of our procedures. And yeah, you can't really close your eyes and not look at the future because the future will be robotic surgery. It's here.
Andrea, it's always a pleasure to speak with you about robotic surgery. You and I met because of your interest in the robotic deep. So I remember all of that, and it's been great to kind of watch you evolve as a robotic surgeon, and it's been great to participate in that and watch kind of what you've done with it. I always love to talk with people who are like-minded in this area, and it's been great to talk to you once again.
Yeah, Jesse, this has been like it's so good to talk to you. It's always so refreshing because I think we share very similar views about the future of robotic surgery. And I'm so grateful that you were able to actually take plastic surgery to the next level. And I think this is absolutely amazing. Yeah. So, always a pleasure.